Asthma is a common long-term inflammatory disease of the airways of the lungs. It is characterized by variable and recurring symptoms, reversible airflow obstruction, and easily triggered bronchospasms, classically wheezing, coughing, shortness of breath, and chest tightness. These may occur a few times a day or a few times per week. Symptoms may disturb sleep or worsen with exercise. Asthma may also present with tiredness, recurrent colds, or poor fitness. Asthma is thought to be caused by a combination of genetic and environmental factors. Environmental factors include exposure to air pollution and allergens. Other potential triggers include medications such as aspirin and other NSAIDs, beta blockers, and ACE inhibitors. Diagnosis is generally based on the pattern of symptoms, response to therapy over time, and spirometry lung function testing. Asthma is classified according to the frequency of symptoms, forced expiratory volume in 1 second (FEV1), and peak expiratory flow rate. It has traditionally been classified as atopic and non-atopic, thought this is an oversimplification. There is no cure. Symptoms can be prevented by avoiding triggers, such as allergens and irritants, and controlled by the use of inhaled corticosteroids. Long-acting beta agonists (LABAs), long-acting muscarinic antagonists (LAMAs), and antileukotriene agents may be used in addition to inhaled corticosteroids if symptoms remain uncontrolled. Treatment of rapidly worsening symptoms is usually with an inhaled short-acting beta-2 agonist such as salbutamol and corticosteroids taken by mouth. In very severe cases, intravenous corticosteroids, magnesium sulfate, and hospitalization may be required. In 2019, 262 million people globally had asthma, up from 183 million in 1990. It caused about 455,000 deaths in 2019, most of which occurred in the developing world. Asthma typically begins in childhood, more frequently before age 25 years, but the onset can be at any age. Boys are affected more frequently than girls and women more than men. Rates doubled over the second half of the 20th century, with higher rates in industrialized countries. There appears to be lower rates in people growing up in farming environments. Asthma was recognized as early as ancient Egypt. The word, asthma, is from the Greek asthma, which means, panting. Asthma is characterized by recurrent episodes of wheezing, shortness of breath, chest tightness, and coughing. Sputum may be produced from the lung by coughing but is often hard to bring up. During recovery from an asthma attack, exacerbation, it may appear pus-like due to high levels of white blood cells called eosinophils. Symptoms are usually worse at night and in the early morning or in response to exercise or cold air. Some people with asthma rarely experience symptoms, usually in response to triggers, whereas others may react frequently and readily and experience persistent symptoms. A number of other health conditions occur more frequently in people with asthma, including gastroesophageal reflux disease (GERD), rhinosinusitis, and obstructive sleep apnea. Psychological disorders are also more common, with anxiety disorders occurring in between 16–52% and mood disorders in 14–41%. It is not known whether asthma causes psychological problems or psychological problems lead to asthma. Those with asthma, especially if it is poorly controlled, are at increased risk for radiocontrast reactions. Cavities occur more often in people with asthma. This may be related to the effect of beta-2 agonists decreasing saliva. These medications may also increase the risk of dental erosions. Asthma is caused by a combination of complex and incompletely understood environmental and genetic interactions. These influence both its severity and its responsiveness to treatment.